work on the range of motion in the scapula and the shoulder. The first technique is called rotating the globe. So you're rotating the head of the humerus into the glenoid fossa. And your hands positioning are going to be on the pecs, and you're kind of over the clavicle as well for a little bit of support. And then the other hand is going to be at the medial border of the scapula and the inferior angle. So you're kind of grasping onto it and really getting a hold. If you think about the scapula, it's like kind of like the shape of your hand too. You can rest your hand right over it. And then you're going to move her up. So when a patient's in a kyphotic posture, or they're bent over, their pecs are tight, their retractors are weak, any of those reasons, you want to get their position better by rotating the globe, rotating the head of the humerus into the glenoid fossa.
And this is on the video, so I mean, for those of you who, if you like to write, you're welcome to, but it's all explained in the video.
And so you can do this with both sides, just symmetry with both sides and keeping the posture nice. And then after that, you can work on scapular mobility, so working on the range of motion in the shoulder joint and the scapula. And
So let's rotate each other's globes.
Pick the person that's standing next to you. Let me rotate your glove. Oh, are we doing it right here?
That sounds weird.
I think you're the only glove I can rotate here.
More here.
And not as much grabbing the humerus as almost kind of over the coracoid process. There and here. And see? Wait, if you look in the video, like Michael says, I almost have my hand over the coracoid and then I'm doing it that way. So don't show it to me like where your hands like that. So try that. Everybody try it on your own. Okay, you feel like you got it?
I can do it. I think a little bit more. Yeah, just from what she was saying. I think
Laura, did you show your boyfriend?
Oh, no, not yet. She wants to show me. You are?
Oh.
Yeah. Okay. Oh, I just told
That is not mine, right?
So now that I've rotated the and share posture a little bit better, I'm now going to work on the scap moves. My position, scapular mobilizations. Yeah. You just range of motion in the scapula and the shoulder. So my hand positioning is the same. So I'm resting over the clavicle and the pecs, and then I'm also resting on the medial border and the inferior angle of the scapula. And I like to grab a little bit in the axilla just to get a little bit more leverage in it.
Personal preference.
Yeah. But so the first motion is going to be elevation and depression of the scapula. Okay, so you're going to move up and then down. And you're actually really grabbing onto that whole area, the whole complex, and moving up and down. And then you want to just check and make sure the patient's not feeling any pain and ask her if she's feeling any pain. And then continue through that motion. And then the next one is going to be protraction and retraction.
And realize that it may take, you may encounter a lot of spasticity, and as you keep working on this, it glides a little bit easier, so that you have to really work on that. I mean, you're not gonna encounter patients that move like Ashley does, okay?
And it's not something that you just do one time and then like their scapula's fine. Like this is something you might do preparatory for most, for the upper extremity activities that you do. So after you do the elevation and depression, you can start to work on protraction and retraction. So you're gonna hold on to the same area and you're gonna retract and protract and retract and protract. And NDT is a lot about moving with the patient. And so I'm moving my body in the same motion that I want her to move at her scapula. So I did the elevation and the depression and the protraction and the retraction. And these aren't all just separate motions. You're doing this like gracefully, moving with them, all together in the same process. I just am showing you them separately because it's hard. The next one is going to be upward rotation and then downward rotation. So upward rotation is protracting and elevating. So I'm going to hold on maybe a little bit distally because she's gotten a little bit better now and a little looser. And so I'm going to upwardly rotate and then downwardly rotate. And upwardly rotate and downwardly rotate. And if she couldn't get that high with her range of motion, you can do it a little bit lower as well. So that's done seating, but you can also do it in an anti-gravity position, which makes it a little bit easier. So if she's lying on her unaffected side, I have a little bit better hold of her extremity, and also it's gravity eliminated, so it's easier. So I can do the elevation and depression, and then move into protraction, retraction.
And I know you're aware of time, so you're doing this quickly,
Yeah.
but we want you guys to do it really slow, okay? Because velocity does what?
Increases plasticity.
Okay, good.
And then you can do upward, downward rotation. And I'm really guiding the scapula. So if Ashley's able to do some of this work herself, I'm going to have her do some of it herself. So Ashley, I want you to do this motion for me, okay? So come back, and now push out. Back, push out. And I'm just facilitating the scapulohumeral rhythm. So making sure that when she comes up in deflection, her scapula is holding in tight and moving properly with that movement.
So if you don't really want to move the humerus past 60 degrees of shoulder elevation unless you have the scapula starting to move, and we learned that in functional anatomy, right? Because we have that scapular humeral rhythm that is like 2 to 1. So especially between the ranges of 60 and 100 degrees, 120 degrees, you should be able to see that scapula rotating and moving. And if it's not happening and you're bringing the humerus up, what can happen?
Impingement. Impingement.
Impingement. So, absolutely. Good. So practice that on your friends, okay?